So you don't hear much about it, but there are things you can do to stay away from the knife. So what can we help? So osteoarthritis, tendinopathies, issues with the ligaments, cartilage degeneration, sprains and strains, and bursitis. Unfortunately, like the little bone back behind this knee, the fibula, we can't really change or help too much. There's situations that we can't help, but for the most part, a lot of the minor or less severe degenerative issues can be helped. So the goal is to heal and prevent further degeneration, not just simply put a band-aid like we were suggesting there. So, taking a comprehensive but conservative approach. Attain Health, we do the quick in and out, like the injections, and get people moving and get you back on your feet, but we're also going to take the approach to get you to where you can go prevention mode as well and not have to be back in over and over again. So cortisone, one of the things we do, most people are familiar with it. It's just a steroid that's an anti-inflammatory, kind of improves the mobility, lasts few months. And then there's visco supplementation, which is like hyaluronic acid. I got a little rooster over there, but it's from coxcomb, similar to the original synovial fluid that you'll have in your joints. So it works to help lubricate that whole thing, but there's a series of injections, anywhere from 3 to 5 injections, and it significantly helps osteoarthritis, lasts longer than cortisone typically. And then we have PRP. It's a form of your own blood, spin it down, and then reintroduce that spun down platelet-rich plasma into the area of effect, the knee, and it releases growth factors. It actually stimulates the number of reparative cells and actually your blood working for you to heal the tissue. Unlike a steroid or unlike the visco supplementation, it actually creates a healing platform. Then there's stem cells. It's kind of the creme de la creme here, but a lot of arthritic joints can see some significant improvements here. So development of new cartilage cells. So it not only promotes healing, but actually provides new cartilage cells. Stem cells means they haven't differentiated into the exact cells that they're supposed to be. So if we introduce stem cells, they're called Wharton jelly, but basically stem cells put into the joint creates new cartilage, lowers inflammation, and actually slows degeneration. The stem cells we use are from umbilical cord tissue. They're, again, called Wharton's jelly. So we can promote the healing, but we also have to look at what is the cause. Pretty important. You have a guy doing external rotation and internal rotation. You can see one's quite a bit more than the other. So how the hip moves directly affects how the knee is functioning. So the knee wants to be a hinge joint, but in order to just only do that hinge joint movement, the hip has to be fully mobile. In this guy's case, not so much. So we have a lot less internal rotation compared to external rotation. That's going to add to what the knee is having to go through. You'll see this. People tend to be more duck-footed, so the hips tend to want to externally rotate. Well, you don't want to walk duck-footed, so you'll bring your feet in kind of more parallel, but that torsion or that torque will go and affect the knee joints itself. Again, more wear and tear. So that hits the knees, and then the shins will actually want to rotate in, and then that's going to break that knee down. How your arches sit. So if this person here has a flat arch on the right side, that's going to cause a knock knee, cause an internal rotation of the tibia, and that's going to break down the knee. So we can address these issues and go into prevention mode if we simply inject it or simply just do some physical therapy, ultrasound. That's going to temporarily help, but it's not going to change the cause. So we're going to get the knee back to functional again. So we're looking at exercises, stability, flexibility, movement patterns that are correct as we can get them, to focus then on not further degenerating something that we're trying to heal with other modalities. So, we're at Attain Health Omaha, 140th and Center. We're taking a comprehensive approach. get you back to doing the things that you should really be taken for granted, kind of like walking up and down the stairs. We're promoting better outcomes, and we're trying to focus on prevention of future issues. We're just trying to help the quality of life and get you back to where you want to be.